In this video, I'll uncover one of the top questions that I get on a regular basis, and that is how to know if you have fatty liver. It's estimated that like 85% of people who are obese have fatty liver. So we want to make sure, like I said, if you have obesity, you're taking the proper steps to identify if you have a fatty liver issue. You just lost your appetite, you're not really sure, you're seeing that you have many of these symptoms, many of these warning signs. This is something you really want to make sure that you're getting checked for. Working towards reversing it isn't the best way to do it. It's actually identifying it's a problem, working with a healthcare professional, because a lot of people will go and they'll search Google and they'll see this stuff on YouTube, and then they'll go, oh, okay, I saw these symptoms, I must have it. Due to the mass increase and ever-expanding obesity epidemic and the sheer amount of people who have a lot of belly fat on their body, one of the things that's happened over the past couple years is the condition of fatty liver has just skyrocketed. Now, this is, scary stuff, because when we look at fatty liver, it's the number one reason that people are getting liver transplants today. And most people are walking around for years, even decades, without even understanding that they have this issue of fatty liver. So that's why in this video, we're going to discuss the number one question that I get, and that is how to know if you have fatty liver. So what we'll first do is talk about some of the different signs that are associated with it, and then the symptoms, and of course, what you must do in order to start taking proper steps today in order to reverse this condition. So stick around to the end of this video, but before we get started, I'm Dr. Zyrowski, and welcome to the channel. If you're new to the channel, it's a pleasure to have you here. Be sure to subscribe, hit that bell notification, and join our notification community, and that way I can help you excel your health and your life. One of the first areas that I want to talk about is going to be warning signs here. Now, the warning signs of fatty liver is basically wrapped up in something called metabolic syndrome. So let's talk about some of these different warning signs and then see if you have some of these symptoms that are associated with these warning signs and fatty liver. And so increased blood pressure is a major one. A lot of people have increased blood pressure. So if you have increased blood pressure, it's something that you have to, take serious, as first of all, you need to work on lowering that blood pressure, but it also can be correlated with fatty liver. Increased belly fat. It's estimated that like 80% of people out there have an increase in belly fat. Okay. We're not talking about obesity. We're just talking about an increase in belly fat. That increase in belly fat really skyrockets your risk of metabolic syndrome as a whole and fatty liver. So, we have to take that seriously. Most people don't even consider that being a problem, but it is a problem that we want to address. The other thing here is obesity. Okay. If you're someone who's obese, this is an issue, and it's estimated that like 85% of people who are obese have fatty liver. So we want to make sure, like I said, if you have obesity, you're taking the proper steps to identify if you have a fatty liver issue. Type 2 diabetes. Typically, people who have type 2 diabetes actually know they have it. It's been diagnosed. Some aren't, but once again, most people do know that they have this. Now, what most people don't know is that they may have prediabetes. It's estimated that over 100 million people have prediabetes, insulin resistance, talking all the way down from kids to teenagers, to young adults, and then of course, even the elderly. Everybody is suffering from this issue of prediabetes today because so many people are drinking sodas, eating a high carb diet, and living a very poor lifestyle. And so this is something that we have to take seriously, as it is a major contributor to fatty liver. Next is high cholesterol, high triglycerides. And then the next thing here is, this is very serious. The thing is about fatty liver, like I mentioned at the beginning of this video, it's estimated to be the number one reason that people are getting liver transplants today. We have to take this issue seriously, because if you have fatty liver, and let's say, you don't ever go to the doctor until it becomes very, very serious, sometimes it's just too far gone at that point. So we have to really take this into consideration and making sure that we're taking the proper steps in order to reverse this issue today. And of course, identify that we have it. Let's talk about some of the symptoms, right? So we have some of the warning signs. Let's talk about some of the symptoms associated with fatty liver. One is going to be a feeling of fullness. There was one time I had this patient come in, and we were working to improve their health on many levels, but one of the things that they always said is that I just feel like I'm really full in this area. I hardly eat anything and I feel very full. One of the other things is that I palpated looking for the liver's edge right in this area, and you can feel that it's just something wasn't right. So anyway, long story short, send him in for an ultrasound, and he comes back, of course, positive for fatty liver. So if you are getting the feeling of fullness in this area, the upper right quadrant, right towards the midline, then there's a good chance that you may have an issue with fatty liver if you have some of these warning signs and other symptoms associated with it. Now, the other thing that you'll get is typically some abdominal pain. So once again, some upper right quadrant pain, some pain that leads a little bit towards the midline. So if these are things that you're suffering from, then make sure that you take it seriously and you get yourself checked. Next thing here is weight loss and loss of appetite. Okay. If you're someone who just has unexplained weight loss, you just lost your appetite, you're not really sure, you're seeing that you have many many of these symptoms, many of these warning signs, this is something you really want to make sure that you're getting checked for, because this is one of the common symptoms as well. Next here is nausea, and this is just unexplained nausea. This is nausea coming from, you don't know where. You wake up in the morning and you eat breakfast, nausea. Sometime in the mid-afternoon, nausea. I've seen this before in patients as well. So it's just one of those symptoms that can be associated with fatty liver. So we just have to take it seriously and literally just use it as a piece of the puzzle to identifying if we have this issue. Next here is weakness. Now this is just unexplained weakness. You know your overall strength in general. And if you're walking around and you're going, wow, throughout the day, I just feel extreme weakness, and, I go to lift things and my muscles feel tired, then this can also be associated with fatty liver. Next here is jaundice, and this is an interesting one. I actually had a friend in school that developed jaundice as a result of a fatty liver issue. Very interesting. As we went throughout the week, he would come to school and he'd become more and more yellow. All of a sudden his eyes became very yellow, and everybody kept asking, like, are you okay? And he's like, yeah, I'm fine. Well, it turns out he actually had too much bilirubin, and as a result, he developed this jaundice from fatty liver. Now, the thing that was interesting about this individual is, yes, he had belly fat, but the thing is that he didn't have any other diagnosed conditions. You wouldn't have expected him to go straight into this like jaundice issue as a result of fatty liver, but that's what happened. Ended up in the hospital 2 weeks, was able to reverse the problem completely healthy today. And, it's just interesting how somebody who you would think is, young, vibrant, somewhat healthy can go and develop these issues. So it's something I had first-hand experience witnessing, and it's something you got to watch out for. Typically, jaundice is more of a later stage liver problem, but it can happen early on as well. Next thing here is swelling of the abdomen and legs. This is a result of the liver not being able to produce proteins properly, but this is something that we have to look out for as well. Next is mental confusion. This is a person who just feels like they just can't, they can't focus. They just are becoming a little bit delirious. We have to make sure that these people who are suffering from this issue, getting this symptom, are actually getting checked for liver problems in general. So mental confusion is the main one. Extreme fatigue and tiredness. It's like no matter how much sleep you get, no matter how much you rest, you're still always fatigued and tired. This is a good sign that you have some issues with fatty liver as well. And persistent itching is another one. This one's pretty interesting. I've seen this one firsthand as well in a patient. They just always complain that they're itching all the time. They don't know where it's coming from. We kind of thought, well, maybe an immune issue, maybe this issue. Got checked for fatty liver, and then of course this person had fatty liver. This is a symptom associated with fatty liver. And so if you're getting persistent itching that's been going on for a couple months now, and it's just constantly bothering you, this can be a symptom of fatty liver as well. Next is breast enlargement in men. So basically what will happen in men if you have fatty liver, the liver essentially just can't process hormones correctly and can't buffer these hormones correctly. So you get an increase in estrogen, which will get an increase in the breast size in men. So we have to make sure if you're seeing this happen to you, that you are identifying it and noticing that this symptom is there so that you can start working towards correcting it. Next thing is spider-like blood vessels, okay? So if you have these are all just symptoms of fatty liver, okay? So if you have the warning signs, you're seeing the symptoms, then you got to take it really seriously. Now, the other thing I want to mention here is that this is not like a proper diagnosis or anything. What you have to do at this point, if you're identifying with a lot of this, is you need to go see your doctor. And then when you go see your doctor, they're going to do a couple things, or they should be doing a couple things, I should say. First of all, an ultrasound is a great way to go here. It's a very accurate way of identifying if you have fatty liver, but also some blood tests, because the blood test will help identify if there's scarring in the liver, if there's liver damage, and really how far this problem of fatty liver has progressed. Okay, so really going to your doctor is the next step. Like I said, seeing this and just working towards reversing it isn't the best way to do it. It's actually identifying it's a problem, working with a healthcare professional, because a lot of people will go and they'll search Google and they'll see this stuff on YouTube, and then they'll go, oh, okay, I saw these symptoms, I must have it. Well, there's a good chance that maybe you do have it, right? But you want to make sure that it's properly diagnosed and is being properly managed, because that way, if it is more severe, you're able to get the proper help in order to reverse this. Now, when it comes to reversing fatty liver, it's very important that we're getting proper exercise. We're reducing our carb intake down to pretty much nothing nearly. We want to make sure that we're reducing high fructose corn syrup, taking that completely out of our diet, making sure that like fructose is out of our diet. We want to make sure that we're taking sugar out of our diet. We literally want to go like straight to a diet like the ketogenic diet where we're getting increase in saturated saturated fats. We really have to make lifestyle changes. It's so incredibly important. Hit the exercise, and then of course, make sure that you're doing everything you can to reverse this issue, because it can lead to more serious issues. Let me know in the comment section below if you've had these symptoms and if you have fatty liver, if you ever notice these pop up. And so put in the comment section below, give this video a thumbs up, share with your friends, because these people need to see this. And then next is check out this video over here on how to go about reversing fatty liver, a complete guide how to reverse it. If our energy system isn't functioning properly, then we're not able to detox the liver. We're not able to regenerate liver cells. We're not able to protect the liver properly.